Hi guys, welcome to my channel. Thank you for joining me. If you're new here, welcome. Don't forget to hit that subscribe button down below so that you can stay updated on all of my videos. If you are not new, thank you once again for coming back for today's video. I'm wearing a scarf because it's snowing here in Minnesota and the scarf is just it's so soft and it just makes me feel so cozy. For those of you that might be wondering, okay, why is she inside wearing a scarf? I actually just came from outside running errands and I still have the scarf on and I didn't want to take it off yet. So today's video is going to be just a demonstration of how I like to give report in the ICU. Now I always get a lot of questions about what's the best way to give report, how do you keep yourself organized and know exactly what points to hit when you're the offgoing nurse giving a report to the oncoming nurse. So a couple tips that I have for you guys as far as giving report would be always get to work early so you can look up the information about your patient. That's number one, because you want to look up whatever events took place for that day that are in the charts and in the doctor's notes and nurse's notes and things like that. Number two, I always say write your report in one color, make changes and corrections that happen throughout the day in another color. Preferably, I like to write in black, then I make my changes in red or pink or maybe even blue. I also like to follow a report sheet. The one I have today, I just kind of rigged up from my house. But the report sheet that I have when I'm on the unit, it's organized. It has boxes for everything and you can go through and just kind of make sure everything that's pertinent to taking care of that patient is filled into those boxes. So that's really, really helpful. If your unit doesn't have a report sheet, you can Google and find all types of report sheets that you can print out and make multiple copies of. I did that a lot when I was in nursing school. You have to really find what kind of report sheet works for you. Another good tip I have when giving report, you want to speak slowly and clearly so the person that's doing any writing can have time to listen to what you're saying or write down what you're saying. If you're saying anything that may be different than what they've already gathered from looking up the patient. You always want to leave time for questions at the end. You want to make sure that you hit on everything. Even if it seems minor throughout the day while you are taking care of the patient, you still need to mention that because that could come back up later. Like, you just never want to leave any sort of information out because it is super vital and critical when you're caring for people. Another good tip that I have when you're giving a report is to make sure that you're in an area where it's just you and the other nurse that's going to be coming on, where you guys can just talk about the patient without being distracted. Now I know on our unit, once 7 o'clock hits, whether it's 7 a.m. or 7 p.m., things get kind of hectic, and it's usually always at that time that somebody's call light is going off. But you want to make sure that you, if possible, are not the ones answering call lights. Hopefully there's like some PCAs or CNAs on the floor and they can answer the call lights, because during the time of giving a report, that's a very vital time. You do not want to miss any information that you're getting or that you're giving during that time. So definitely try to minimize distractions. Always have multicolored ink so you can write in one color and make changes in another color. And just make sure you're clear, you're concise with your information, you leave room for questions. Okay, so those are just some quick, simple tips that I have for you guys as far as when you give report. When you're receiving a report, you want to make sure that you write down, everything that the nurse is saying. You want to write down any questions that you may have, so at the end you can be like, okay, well, I have a question about this, or, I'm fine, I don't have questions. So just always be thinking, when you're the one that's receiving the report, is there anything that I need to ask that I have not asked already or that I have not heard answered already? One pet peeve of mine, I will say this, when I'm trying to give report, I'm going to get to everything. And if I don't get to everything, I'm going to leave time at the end for you to ask me questions. Please do not interrupt me every 2 sentences to ask me something that I'm going to get to if you give me time. That is like a huge pet peeve of mine. That's happened to me a couple times before and I'm just like, oh, okay, so I'll answer that and then I'll be like, but I'm going to get to that, or I'm going to give you some further information on that. Please try not to interrupt the person that's giving a report. Just like jot down your questions if you have a question, or just wait till the end and then you can be like, well, I have a question about this, did you do this, did they get this, or whatever. But the interrupting can be very distracting and it's sort of rude, and then the person that's giving report can kind of lose their train of thought. So don't be that person. Don't be that person. Okay, so I'm gonna jump straight in. I have a report right here that I'm going to give to you guys. This is all completely fictitious. I just made this report based off patient populations that I've dealt with in the past so far, and how I know my report goes and how I know my report sheet is. So this particular individual is completely fake. Everything that I talk about is completely fake. However, it is things that I have encountered before, but it cannot be linked back to a specific person because I know there's HIPAA and all that kind of stuff. So this report is going to be a fake report, just so you guys know. All right, jumping straight in, I'm gonna go ahead and I'm gonna start my report. Hi, are you gonna be taking care of Mr. Winter today? Okay, so Mr. Winter is a 56-year-old male. He has a full code, no known allergies, and his diet consists of no raw fruits and vegetables. He is admitted under HEME BMT service, but our critical care service is covering him. So I'll go into some history here on Mr. Winter. Mr. Winter was diagnosed in 2014 with large B-cell lymphoma. He also has a history of OSA, hypertension, hyperlipidemia, acute kidney injury, and depression. He has had a pretty complicated medical history since his diagnosis. Some severe mucositis, severe thrombocytopenia, just some severe reactions with chemo and things like that. So that has kind of complicated his medical history. He has been seen in and out of the hospital multiple times since his diagnosis. His last round of chemo was 11/30, so a couple weeks ago. And then a couple days after his last chemo, he was admitted to his outside emergency room. He had shortness of breath, cough, fever, and some abdominal pain that had been going on for about a week or so. Upon admission, he was found to be tachycardic and hypotensive. They drew some labs. His lactate came back elevated at 8.2. They did start some 0.9 fluid boluses, in which he received 2 of those and still remained hypotensive despite fluid resuscitation. They were not comfortable continuing to treat him there because of some early signs of sepsis, so he was transferred here and has now come to our ICU for further care. Since coming to our ICU with the septic picture, we did do another 3rd fluid bolus, so he's had 3 fluid boluses so far. We did a liter of 5% albumin, and then we did start him on norepi. Any questions about that at all? Okay, so I'm just going to go by systems here for Mr. Winter. For lines, you have a left forearm peripheral 20 gauge, and then we also placed a left IJ today when he got here so we could start him on the pressors. Currently, you have 1 port that's open. 1 port currently has the liter of albumin that's finishing up, and then your 3rd port has your norepi with a 0.9 piggyback behind it. Norepi is currently at 0.06. Now, cardiovascular wise, Mr. Winter still remains sinus tach in the 110s. That has come down some. Upon his earlier admission, he was up to the 130, so he is slowly coming down. +2 pulses all around. His systolics are still kind of lingering pretty low. Right now they're in the 90s. MAP goal is greater than 65. He is currently at a MAP of 70 with norepi at 0.06. I have not had to do much titrating on the norepi. The highest that he got to was 0.07, so not too much off from where he's at right now. Respiratory wise, his lungs do sound a little coarse. Respiratory is going to come and give him a couple duo nebs. He has a weak, non-productive cough, and he is a bit tachypnic with his respers in the mid-teens. GIGU, his last bowel movement was 3 days ago. He is voiding currently, clear, amber, no sediments, and he's voiding about 100 every couple hours or so. He'll call just for us to empty his urinal, and it's been about 100 or 150. Skin-wise, there is some generalized bruising. He does have some pretty fragile skin from chemo and things like that. There is a scab on his left shin. He hit his shin at some course last week or so at his home, so it's just kind of scabbed over. Other than that, his bottom looks fine. No redness there. Labs, we did draw another lactate that is currently pending. Everything else has come back relatively normal. I have not had to replace any electrolytes at all. Family-wise, his wife and his son are here. They're very, very anxious, as you could imagine. Tons of questions, but very nice and super supportive. Miscellaneous and other things, as far as a plan for what to expect. They do want to have a portable abdominal x-ray. They also are planning for him to go down for a CT, and then they're also going to do an ultrasound just of his heart, just to see what his EF is and things like that. As far as pain, he has not really complained a whole lot of pain like he was earlier. He said it has actually come down some. He's been rating it as like a 5 or a 5.5 out of 10. So he does have a PRN order for Oxy 5 to 10 milligrams Q4, and I last gave him 10 milligrams of Oxy at 4 o'clock. So around 8 o'clock for his 8 o'clock meds. If he was having any pain, you could bring the Oxy in with him, or you could bring the Oxy in at that time. So that's all I have. Was there anything that you had questions about at all at this time? No? Okay, so great. Well, let's go in and say hi so I can introduce you, and then I can say my goodbyes, and then we'll do our drip check, and then we'll go. That's it, guys. That's it. I just wanted to make this video just so you guys could see what it's like to give report, give you guys some good tips on how to be a good report giver as well as a good report receiver. And so yeah, if you guys have any questions, leave them in the comment section below. Make sure you find me on social media, and I will see you guys in my next video. Bye.